Two. Hi, my name's Crystal. I'm your telehealth nurse from Northwell. How are you feeling after being discharged from the hospital?
Hi, Crystal. Okay, I guess, just nervous about being readmitted.
Of course, I understand. Let me try to help you better understand your diagnosis to calm your nerves. How does that sound?
That sounds good. Thank you.
Okay, awesome. Let's get started. I understand you've been diagnosed with congestive heart failure. Is this a new diagnosis for you?
Yeah, just kind of came out of nowhere and it's really scary.
Totally understandable. Let me give you a background on this diagnosis. I think that would help. Congestive heart failure is a chronic diagnosis, is when your heart cannot pump or fill adequately. Your symptoms might be shortness of breath, fatigue, swollen legs, rapid heart rate. Have you been experiencing any of these symptoms?
Yeah, at first, I experienced the swelling of the legs and some shortness of breath. I was barely able to walk a block, and my legs were just so full of fluid, I could push down and leave an indentation.
Right. Those are classic symptoms, and I'm glad you went to the hospital. Those aren't symptoms you want to ignore. One of the things I like to do is educate my patients on how to manage their illness. I find it helps decrease their stress. Do you have the PDF attachment to follow along with the teaching?
Yeah, I do. Actually, I was wondering if I could, record the meeting just to go over with my wife later, if that's okay with you.
Absolutely. That's great that you have a support person to help you with this diagnosis, and it's definitely important to get them involved with understanding what you need and where you are need the support. So definitely record the meeting, and if you have any questions, either you or her could reach out to me as well. So first, we're going to go over the CHF zone chart. There's three different zones if you see on your page. So you have
Mhm.
the green zone, yellow, and the red. Green meaning when you're doing well, you have no shortness of breath, no swollen legs, no weight gain, no chest tightness, no decrease in ability to do activities. And then the zones go from there. So yellow zone, you gain 2 or more pounds in a day, 5 or more pounds in a week. And then red zone is like you're having unrelieved symptoms, you're having symptoms that are so severe, and anything that's past the yellow zone, you're going to go to the hospital. Anything in the yellow zone, you're going to call your doctor. Green zone, you're doing well, keep it up. All right. So what we're going to do is we're just going to go, now that you have a chronic illness, you're going to have to deal with going to appointments. You're going to have to deal with working with the medications. So the next few pages kind of go over how to talk to your doctor. Keep note of any questions that you might have. Sometimes it gets overwhelming when you have appointments with the doctor. You can also reach out to me with any questions. We're going to have you now weigh yourself daily. So do you have a bathroom scale at home?
Yeah, I
Okay.
do.
All right, so you're going to weigh yourself in the morning, 2 or more pounds in a day, 5 or more pounds in a week. Those things that you want to just keep track of, just recording your weight daily and seeing how your symptoms are, what zone you're in, and going from there. The next part of the pamphlet kind of goes into the medications because we want you to be an active participant in your care. We want you to understand what these medications are for, what they do, what symptoms and side effects to look out for. So we want to make sure that you understand that. You might not be prescribed all of these medications, but some of them. So we want you to match up to the chart. Once again, I'm throwing a lot of information out there to you right now. So just take in what you can. And then every week, we're going to go through a different part of the PDF and a different part of the teaching more in detail. So I'm just giving you the overview right now. Next, we really want to talk about healthy eating. We want to make sure that you're on a diet that promotes wellness. So we want to make sure that you're not taking in a lot of sodium, trying to limit that. You're also going to be limiting your fluid intake now with the diagnosis of congestive heart failure, between 4 to 6 8-ounce glasses a day. And that includes yogurts, ice cubes, gelatin, everything, all those things can be included into your fluid intake for the day. Now, this goes very in depth into how to cook, how to meal prep, what to do when you're eating out. Like I said, we're just doing an overview, and these are all things that we can go more into detail, okay? And just talking about rest and recovery, but also trying to make sure you're getting active, taking walks, getting outside and trying to promote cardiovascular wellness, maybe even going, I don't know if your doctor has prescribed you this, but maybe going to a cardiac rehab where they go into the medications and they go into exercises that are good for your cardiovascular health. Also, I don't know, I think you got in the mail already that if you didn't have a bathroom scale, we would send you a bathroom scale. We'll also send you a water bottle to help manage your fluids, and a pill dispenser. The pill dispenser help you to remember when to take your meds. Just kind of makes it easier for you because you are on new medications, which can be kind of overwhelming. Um, so I really kind of just want to give you an overview, and I know it's a lot of information. All right.
Yeah, no, it's definitely a lot of information. But thank you for all the material. I
Mhm.
do feel like I have a little bit of a better understanding of how to care for myself and manage my symptoms. Um, and also, I feel more comfortable and have a better idea of when to reach out for help, either by calling my doctor or going to the hospital.
That's wonderful. I'm glad that you feel a bit more able to take care of yourself, able to manage your illness. Once again, you have any difficulties or things that you could pop up, you could reach out to me either by email or you could text me. Anything that you feel like is urgent, you can go to the emergency department. Anything that you feel like needs to be followed up with your doctor, absolutely make an appointment. We're all here as a team to help you manage your care. You have your nursing team, but you also have your family members. So your wife is going to be a big support to you depending how this process goes. The doctors are involved, everyone is all involved, and we want to just make sure that you're doing the best and we have all the tools to do your best that you can. All right. Do you have any other questions for me?
No, not at this time.
All right. Okay. So if you do, I know it's a lot of information. So if you do, you can send me an email or a text. We will have another follow-up appointment, probably, let's say November. So December 1st, we'll do another follow-up appointment. We can deep dive into medications and go all over all those things and check in on how you're doing. Okay. All right.
Okay.
All right. So I'll see you then. Okay.
All right. Thank you, Crystal.
No problem.